Folks, this week I wanted to find out a little bit more about oncology social work. And this field of social work specializes in addressing the non-medical psychosocial needs of individuals and their families who are facing the impact of a potential or an actual cancer diagnosis. Social workers in this field provide services for individuals throughout all stages of cancer treatment, including preventative, diagnostic, and treatment education, survivorship support, to help defining cancer-related terms and navigating prescription and insurance needs, through finding and securing safe pain management resources. For families and caregivers, social workers ensure that people are connected to adequate care, resources, and support, and, if necessary, hospice resources and bereavement counseling. So today, patients are expected to take a greater part in the direction of their care. And this has the potential to grant patients greater freedom in finding and receiving care. It also means that they spending less time with physicians and ultimately have to take more responsibility for their own care. Social workers who specialize in oncology recognize that during these initial, days of the health crisis, patients may not initially be in the position to adequately understand or manage their own health needs, or they may emotionally find this to be overwhelming, confusing, and quite frankly, unmanageable. So it's in this role that the social worker is able to stop, listen, and be witness to not the pathology, but for the person behind the illness. Additionally, oncologic social workers work in the community-based services to address the need for education and advocacy, as well as collaborative services to the patient, family, and their community. Social workers also utilize the services available to at-risk populations, including organizing volunteer services and programs to promote education and cancer screenings. Oncologic social workers also advocate and lobby on Capitol Hill and encourage members of Congress to attend cancer awareness events. This helps to gain knowledge and promote the continued funding for research and treatment. With standards of care that include a responsibility to be knowledgeable and competent in diagnosis, treatment, intervention, and community and government resources, these social workers must be willing to address both the micro and the macro factors in cancer treatment. So I share my desire to learn more about this because my mother-in-law this summer had to have a tumor removed from her brain. About a month later, she had a cancerous growth removed from her arm. And then about a month after that, she had a hysterectomy for uterine cancer. So our family has definitely, seen the impact of cancer firsthand. And I will share that it's been very difficult to navigate not only the medical piece of her care, but the family dynamics which have simultaneously sort of strengthened and been challenged in many different ways. And so I can only speak to the fact that I wish we had had a social worker to help navigate through these resources. And quite frankly, I didn't know that this was something that was available. So for those of you who may be going through similar situations with loved ones, please, I hope that you're able to find this resource because I sure wish that we had. Anyway, my mother-in-law is doing great, by the way. Thank you for listening. Have a great night.